Hi everyone, this is Jason Berry with Digital Health Wire, coming to you back again from ViVE in Nashville. I'm here with Michael Dalton, who's the CEO of Ovatient. Michael, it's great to have you here.
Thank you for having me.
So Michael, why don't you share with our viewers a little bit about Ovatient and the work that you're doing?
Yeah, so Ovatient, it's a virtual first multi-specialty practice. We're built on Epic. We provide today virtual urgent, I like to call it, really same day acute primary care, a virtual primary care, as well as an integrated behavioral health solution. Our focus is providing whole person care, being able to meet the needs of our patients, both physically, mentally, as we talk about like from a behavioral health perspective. It may be that you need more than support for your anxiety or depression. We're able to help you really in your weight management goals, addressing your diabetes, the chronic conditions that you have. And so really we try to take that approach, be an extension of our health system customers. We are focused on how do we support health systems in their journeys to provide really patient-centered or person-centered care, as I like to focus on. And it's also a great opportunity for providers because we're built on Epic. It's a great recruiting tool for them to be able to say, I want to remain connected to a health system. I want to provide high value care. I want to be part of a dedicated and focused practice. So it's a win-win, I think, for the patients, or maybe it's a win-win-win for patients, our health system customers, and also our providers.
Nice. It seems like a pretty straightforward model, but I'm sure there's some things that people still manage to get wrong, still manage to have misconceptions about. What are some of those areas that you can maybe share?
Yeah, I think there's a couple things. The first is that oftentimes virtual care still is equated to, or people think it's synonymous with urgent care. It's not thinking about I can have a longitudinal journey. And that's where we say, what we provide is virtual first care. It's not virtual only. And that notion is that you can be seen, whether it's that urgent care visit, a virtual primary care visit, or partnering with your behavioral health provider. And then we're able to continue to see you. And there will be times that when you're going to need a lab, you're going to need imaging. You may need to go pick up a script. We do have a same-day delivery service, but there's still things that are going to be required to, leave the home. But the idea is that we want to honor your preference that you prefer to be able to get your care virtually. So I think that's one thing. I think there's some other misconceptions that it's not the same quality of care. I think actually we have and our NPS score demonstrates it. What we see from our patient satisfaction scores and our quality scores is actually it's equal to or better than. Oftentimes that in-person care, our patients are more engaged. They feel more comfortable asking questions. They have a greater therapeutic alliance. I think that's just one of the misconceptions that exist out there. That you can't have that high quality visit. And we absolutely think that you can and have demonstrated that.
Nice. And what are some of the biggest trends that you're seeing out on the show floor that might be being underweighted that you think will really help or really shape virtual care as we look ahead to 2025 and next year?
Yeah, I think maybe, and there is a different focus this year. I think every year there's always kind of what's the shiny new object, and there's definitely a focus then on the floor. This year, there's a lot of focus still around AI, and I think that it still has a way to be able to mature, but I think it can support providers. I think that's where a lot of that focus is in, about being able to support a provider and being able to provide a better experience for them, being able to extract data in a way that will allow them to be more efficient. We still are struggling with provider burnout. We do have a shortage. I don't think AI is the be all end all in the solution. It's one of many solutions that we need to be able to have. I also think too that there's still to go back to your last question, I still think that patients want to be connected and be able to talk and connect with somebody. That's not going to be replaced. I think there's some convenience factors that come along with virtual care, but to only provide a means by which to do something asynchronously, patients, we like to say it's virtual care that's entirely human. That human element is still so important, both for our providers and for our patients. They want that connection to the patient and the provider likewise.
Nice. And what are some of the things we have to look forward to coming from Ovatient, coming from the work that you're doing? What are you excited about if you look into the crystal ball for the rest of the year?
Yeah, so we're really excited. We've been working with MUSC and we'll be going live with them in next month in March to be able to provide our suite of services. I'm excited that we're going to take our virtual behavioral health and partner with their virtual first specialty offering. They've been a real leader in that space around virtual first specialty and having some dedicated specialty providers. So it'll be a great collaboration in that space, and we'll bring our virtual primary care and urgent care to provide those video visits and that care continuity. And what I'm interested in that is, while Metro Health, our first customer, has really been focused on more of a urban, suburban kind of footprint, for MUSC, they run the gamut.
Mm-hmm.
I mean, they are across the entire state. They have a large rural and exurban communities that they care for. And so I really think bringing our virtual first solution in combination with their care network across the state is going to be a win-win-win for our patients, our providers, and for the health system as a whole.
Nice. It was a win-win-win for this interview as
Yes.
well. Michael,
Thank you.
It's good to see you.
You too, Jason.
Thanks, everyone. That's been the Digital Health Wire Show, and we will catch you next time.